the disclaimer again. So again, my name is Monica. You are on Echo FM. The opinions expressed on this show and by the doctors are for educational and informational purposes only and are not intended as a diagnosis, treatment, or as a substitute for professional medical advice. Diagnosis and treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you've heard on this show. Echo FM does not recommend or endorse any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned on Echo FM show. Thank you so much. And again, let me very quickly introduce the guests. I have Dr. Chiagozi Nasuruba, internal medicine, UT Southwestern Tyler, and Washunji Rangu, RN, BSN healthcare, public health nurse, and Dr. George Agag, PhD, immunologist and vaccine development at UCLA. Welcome again. And Washo, do you want to talk very quickly about the lockdown and in California and everywhere else and why the numbers went up?
Yes. Again, thanks for having me in the show. Technical difficulties, I guess they are unavoidable sometimes. But thank you for having me in the show, Monica. Again, my name is Washo, and I do public health, and I also am an ED nurse. Talking about the lockdown. Now, like I had explained before, the diseases, infections are in us. Infections are carried by us, the human. The moment you cut off the movement from one human, from one place to the other, then infections are in us. Infections are carried by us, the human.
Go ahead, I'm sorry.
Yeah. So the disease will not move from one point to the other, okay? As long as, you cut off that movement of, people from one area to another area, okay? So that's all the lockdown is. It has worked very, very well in New Zealand. It has worked very, very well in Australia. It has worked very well even in countries in Africa, a country like Cote d'Ivoire. They are very, very much in the awareness of preventive medicine, especially when it comes to like Ebola. When they cut off movement and give a quarantine, it means exactly that. So the infection was slow in the beginning. I can agree to that because somewhat we agreed in the lockdown. We agreed to have the lockdown, say in the beginning of March, April. Yeah, there was not so much movement, but then But then again, at some point, you can only do so much, especially when it comes to, to people who are used to making their own decision, going their own way, in terms of, life activities. And once we broke that lockdown, then the infection, which means me, like Washo, we started moving the infection around. We started moving the infection from here to another spot. So that has been the main thing that we have not, I think that we have taken for granted movement of the disease from one spot to the other. And I think that's why we are where we are. That's why Los Angeles is recording a death every 6 minutes. There never was that cutoff, from movement, from people movement or the movement of the infection. Thank you, Monica.
Okay. And so Dr. Chiagozi, you were talking about this moving plane.
Right. Again, thank you for inviting me. My name is Chiagozi Nasuruba. I work for the UT system as part of UT Health Northeast in Tyler, Texas. I am an internist. I'm also a hospitalist.
Go ahead. I'm turning on my light.
Absolutely.
Go ahead. You go. Go ahead.
I see patients in the hospital who have COVID, along with my other colleagues. This remains a moving target. In that what we knew from the beginning has now changed. Initially, what we are told that if someone comes in and they're very short of breath, that you want to put them on life support early. This has now changed as we have found out that this is a different kind of lung disease that these people have. In fact, their oxygen level may be very low and they will still be happy. We'll call them happy hypoxic patients. Quite unlike those who have severe lung disease, when they're very short of breath, they will be very distressed, quite unlike those who have COVID. So it has now been shown that they have something called microthrombosis. So they have some small blood vessels being blocked in the lungs. So they are prone to having blockages in the blood vessels in the lungs, which means the system is different. The other thing that was found out initially, we were told not to give them any steroids, but now it's been shown that there's so much inflammation. The body is trying to protect itself, thereby mounting so much inflammation. It has now been shown that those who have low oxygen level will benefit from using steroids. So we're now beginning to use dexamethasone. This was based on a study that was done in UK, showing that there's decreased mortality, which means people's lives have been saved by using steroids. So we are now using more and more steroids, and also not putting people on life support early. Putting people on life support now has become the last resort. We'll give them on oxygen, we'll put them on what is called high flow nasal cannula, put them on something called BiPAP or OptiFlow before we consider intubation. So this remains a moving target. We'll still have a lot to learn, but it is important to let people know that there is no cure still. All medicines that are available are just mainly supportive. There's no cure yet. Therefore, it still follows that prevention remains better than cure. Unfortunately, there's no cure in this case. So our best bet remains prevention.
Wow. Okay. And so Dr. Agag, a lot of people have been asking, what is the science behind 6 feet? Can you explain that?
Science behind the social distancing?
Yes.
All right. Okay. Thank you.
Why does it have to be 6 feet?
All right. So this is more of a public health question. So, most of the time, if somebody is infected by an infectious disease, when you cough, this is a viral infection. When you cough, you're gonna release the droplets. Okay. So some geek in the lab, what they did was to measure how far the droplets can spread, and they found that if you're sitting 6 away from a person, then it means that you're not going to be exposed to a very high viral load, and because of this, you won't be able to get infected, and then after infection, develop clinical disease. So 6 feet is recommended, and it's very important, especially if you're working within closed environments, for example, in the offices and closed buildings where AC is constantly running and there's no clean airflow. So I think that's the basis of the 6 feet. So it's a science. Somebody did it, and it's very, very effective in preventing infection.
Okay. All right. And Washo, you and I talked about this last night, but I'm going to ask it anyway because someone brought it up again this morning. So, Dr. Agag, ever since COVID came, a lot of scientists, would come out and tell us you need to boil garlic and ginger, a concoction that everybody, not everybody, but I personally really, really believe in it. And I make my son drink it, but he won't. But can you tell us if there's any science behind it, or does it really help with COVID?
Okay, so we have to remember where we come from. Okay, so we all have a background from Africa, and we all know how we were raised. We had our grandparents boil that marubaini tree. Remember marubaini? So this is a tree that's we know that you take the once they boil the marubaini, you drink this, and they used to claim that marubaini could treat at least 40 diseases, right? And it was effective. And that's how we grew up in Africa. And is there medical relevance to this? The answer is yes. And some people can say, no, these treatments do not work. But this is what, this is my take-home message. Most of the medications that we use in the clinic, they're derived from plants, right? All we need to do is somebody has to do, purify the active moiety of the drug or that's found within these boiled concoctions and try to figure out, what it is. And once we figure out what it is, then we can develop a drug the way they do it here in the Western world. But unfortunately in Africa, we don't have the technologies to develop this. But when you drink these concoctions, they do work. They used to treat the fevers, right? Remember, they used to be effective against malaria. And then if you look at viral infections, for example, if you put somebody in a humidifier or in a humid environment, you can control the viral replication, right? Because the steam kind of allows the opening of the airways, so you're able to breathe better. The virus is not able to replicate better. So, that's my take. I think there's some relevance to it, but again, some people are gonna disagree. But it's the jury's out there to judge whether this medication work or not.
Okay. All
Monica,
right. Okay.
can I jump in?
Yeah.
Again, all these things are anecdotal, but I will also say it's good to try them, but it is not a substitute from not following social isolation, not following wearing mask. And also people should realize that if they're on other medications, they have to be careful not to mix them with medications, because these may have some active ingredients that may interact with someone's medications. So we have to be very careful that we don't mix those concoctions with our medications to avoid bad interactions and avoid them being damaged, basically. Yes.
Yeah, because nobody has done again a clinical study to see.
That's correct.
How these interact.
Yeah. Okay. Definitely. Okay. So what I really wanted us to talk about today is the vaccine. I think the vaccine is here. It's new, and there's a lot of information, misinformation, disinformation out there that I'm hoping that you guys can help us clear the air. So I'm going to start with you, Dr. Agag, because Washo told me that you are in vaccine development, you are involved in this. Just tell us, what was your involvement?
Okay, so
it gives you the legitimacy of now giving us this information about the vaccine.
I have a disclaimer.
Go ahead.
I have a disclaimer.
Yes.
So my training is on vaccine development. Significant contribution in the development of the malaria vaccine that's currently being used in Africa, and it has around 30% efficacy. Okay, so I understand how vaccines are made. Have I worked on the corona vaccine development? The answer is no. But do I know how the technology works? The answer is yes. So what's this corona vaccine? So these are the different types of vaccines out there. So the coronavirus vaccine, it's an mRNA vaccine. And so what's mRNA? So mRNA stands for messenger RNA. And so the way they did this is, they inject you with the mRNA, so it gets into your body, and then it's going to instruct your cells to make a protein. And this protein corresponds to the viral spike protein. And what's a viral spike protein? So this is the protein that the virus uses in order to infect your cells. So the key here is, if we can block this interaction between the viral spike protein with the receptors on the immune cells, it means that your cells are not going to be infected. So if you don't get infection, you're not going to develop clinical disease. So it's like a lock and key, all right? So you have a key that gets into a particular lock. So if we can block the virus from getting in, then you get protection. So what's the lock and key? So again, this is all about your immune response. Once your immune cells make the particular protein, they're going to express this protein on the cell surface, right? And then your other immune cells, such as B cells and T cells, they're going to start making, for example, the B cells are going to make antibodies, and these antibodies are going to be very, very important because they'll be able to neutralize the virus upon, exposure, right? So that's how the vaccines work. So is it safe? Yes, the mRNA vaccine is very, very safe. It's not incorporated into your DNA. So once you make the protein, the mRNA is degraded, okay? So the virus is not gonna be part of your DNA. So this is the main concern that people have. That, again, it is safe, and this technology is very ingenious, and it's also serendipitous, and just go out there, encourage you guys, whether it's a Moderna, whether it's a Pfizer vaccine, they both work in the same way. They have 95% efficacy, and they did a big clinical trials with over 40,000 people, and nobody died. Even though there are some side effects, we're going to talk about those, but just know that it's very, very safe. Side effects are few, but vaccines are safe. So go out there, get a chance, get the vaccine.
So
Monica, can I jump in?
Can I jump?
Yes, sir. Yeah, you can. I was just gonna say, I feel like I just walked out of a microbiology class.
Very simplified.
Right.
Go ahead, Dr. Chiagozi.
Sure. George, I appreciate your explanation. And I'm also here to say I encourage people to take the vaccine.
Yes.
I have taken the vaccine. I've completed the 2 course of Pfizer vaccine. Initially, with the first one, I had some annoying headache. Of course, this is like 2 out of 10 headache. It didn't prevent me from doing anything. It lasted for about 3 hours and went away. I've had my second vaccine without any side effects. So I encourage people to go and have their vaccines. It's better to have the vaccine than to have the disease. I have seen firsthand what this disease has done to people. If it does not kill you, you will suffer. And not only that, there are some lingering after effects of the illness. So please, I encourage everyone to go and have the vaccine. I have not developed 2 heads. I still have 1 head. So the vaccine works. It's good. So that's my take.
I can also add that.
Sorry, Doctor.
Yeah, I was going to say, Washo, I know you've taken the vaccine, you've had both of your doses, correct?
Yes.
Did you have any side effects other than maybe, a little pain at the site of the injection?
See, when I got the first vaccine, I was actually at work, and I got my vaccine downstairs, and I came in for my 12-hour shift, and somehow I completely forgot that I had the vaccine. When I introduced myself, I said that I really, really love data collection. So this is something that I've been waiting for. I wanted to actually document every day what my symptoms are gonna be and how, by the end of 12 hours, I had already forgotten that I had, any vaccine. And then I went in for my second shot, the same thing, just, the little pain on the arm. To be honest with you, my appetite got higher, but I'm trying to test some, I don't know, I'm trying to test different tastes of pigs and what, I don't know. Yeah, but personally, for me, I did not have any side effects other than the arm. But then again, we are all different. Washo will have very, very minimal effect. Another person will have a very minimal effect. However, I wanted to talk about the vaccine also in the context of what we are seeing right now. Okay, just to add on what Dr. George Agak and Dr. Nosurumba have spoken about. Now, we could not afford to have a lockdown. Just connecting my two, the discussion that I had, the opening discussion that I had earlier, and also the vaccine. Now, we could not have a proper lockdown, and I don't think that will happen in the United States. I do not know. I really, it's not something that I can actually count on, okay? So we could not do that. So the infection is still moving from one point to the other. Okay, now the biggest thing that I wanted also to highlight is that we are having now very, very many variants of COVID. virus. And why that is happening is because we have not been able to stop completely the movement of this vaccine. The more we do not control it, the more we will have more variants, okay? And the other thing, most importantly, we do not know which variant will cause what, but we know the mRNA vaccine has been tested and has been effective in majority of the variants. So comparing the two, do I get the vaccine or do I just sit it down and actually wait for this new variant? We right now have a South Africa, we have a Japan, we have in America, they have tested some variants that have not been seen anywhere. And this trend will continue actually because we do not have the control of the disease, okay? So when you look at the two, which one do you pick? Do you pick the little bit of a headache or 2 out of 10? The same, vaccine that Dr. Agak has clearly explained. It is not a gadget that is put in you. There is so much propaganda out there. Again, if people could just listen to the reality behind this vaccine, it was politicized from the beginning. It was, we have a lot of propaganda about it, but that doesn't make it true. Like Dr. Agak has explained, that's the truth behind the making of this vaccine. I've already had it. The doctor has already had it. Dr. George Agak has already had it. So my encouragement to my people, please take the vaccine. We do not know where we are going with this COVID-19. We do not, and also it's gonna be there throughout the year. That's one thing I can also guarantee. It's not gonna be a seasonal disease from what we have seen right now. We've had this since March, it's still there until now. So it's gonna be a disease that's gonna be endemic all year round, and it's gonna keep mutating. So if you have a better solution like a vaccine, which we already have, then let's go for it. Thank you, Monica.
So Dr. Agak, you wanted to say something about that?
Yes, so again, I also got the 2 Moderna shots, and I'm still standing, and I'm very excited about the opportunity, and I hope that our listeners will, I encourage our listeners to go get the shots. And so the viruses are also very smart. The virus is just not going to sit there and wait for you to kill it. So what does it do? It goes ahead and it undergoes lots of mutations. So it's going to try to change some of its proteins that are normally seen by the immune system, right? And the reason it changes its proteins is because of the immune pressure. Okay, so once we start putting immune pressure, once you start developing these antibodies and T cells that kill the virus, they're going to start changing the key that your immune system sees. And this is how the variants develop. So how can we stop this development of new variants? I believe there's the UK variant, there's South African variant, and other variants are coming up. And for example, there's a new variant, the B.1.17. This is the one that's coming out of the UK, and it's very, very infectious. So, right? So if we get the vaccine, we're gonna stop this development of variants, and we're able to eliminate the virus, and we'll be able to kind of take a hold of this coronavirus disease.
So Dr. Chiagozi, I was gonna ask you, with your patients, or frontline workers, that you come across, especially minorities, Africans, we are skeptical. I'm just going to say we are very skeptical to take the vaccine because of, again, as I said earlier, because of the misinformation and disinformation that is out there, especially Africans in Africa. When this vaccine started to be developed, there was a video that made rounds on social media that Kenya was going to be a guinea pig. So Africans do think that they're actually going to be used as guinea pigs. So minorities here in America, as much as they are, frontline workers, they still do not want to take the vaccine because of that, skepticism, and the mentality that, this is not for us. It is not good. It was developed very quickly. I mean, whatever the case, so what do you tell people you come across or patients, especially those that have, underlying conditions and comorbidities? What do you tell them?
Thank you, Monica. I encourage them, that this is, we all realize what has happened in the past. Times are changing and times have changed. A lot of us are involved in vaccine development, just like George is. A lot of us are involved as frontline workers. A lot of us are involved as data collection, workers. We are in the mainstream of researching on COVID and treating COVID. The other thing is also that in terms of mortality, the minorities are dying more than the whites. So we have to do all we can to prevent getting the disease. We'll have to, again, socially isolate. We'll have to get involved in getting the vaccine. Because if we don't and get the disease, then that's where disparity may come in. You may not have the opportunity to get all the good treatments that someone who is very affluent may get. So disparities still exist. But it is important to note that the minorities that were dying more from COVID. So whatever we can to prevent from dying from the disease, we ought to do so. Right now, the best thing for us is to take the vaccine. The vaccine is made for everyone. There's this myth about, they're trying to reduce population in Africa. Why would anyone want to reduce population in Africa? What would an African do for an American here? The African is in Africa, the American is here. I mean, there's no competition whatsoever. I don't know why someone would believe that they're trying to reduce population in Africa by giving them vaccine. Please, my people, the vaccine is important. There is coronavirus in Africa. In fact, I just had a friend of mine just came back from Nigeria with his wife. And he just announced on Facebook that the wife actually came back with COVID. So COVID is not an American disease or Chinese disease. It's a pandemic. It's all over the world. And I see people congregating all over Africa, doing marriages, funerals without wearing masks. That's not good. So again, I still encourage my people to socially isolate, to wear their mask, and then take the vaccine when they have an opportunity, because that's the only way to cut down, to reduce, to prevent, and to stop the spread of this deadly infection, which also has lasting effects, even if you survive. Thanks.
Dr. Agag, something that Dr. Chiagozie mentioned there. I think some of the Africans, they were showed there's a video too out there that talks about that they need to reduce population in Africa, and so this vaccine, though, it was produced very quickly. I think this is the fastest we've ever had a vaccine. So do you, in your opinion, think that we compromised, or the scientists did, because I did, the efficacy and safety of this vaccine?
Okay. So the answer is, this is a pandemic, okay? And when it started, nobody knew what COVID was all about. Okay, so the United States government came up with a plan, and they guaranteed the pharmaceutical companies, they told them, you're gonna develop this, we're gonna give you the money. So vaccine development, this process normally takes, close to 10 years. Why? Because the pharmaceutical companies, they work on their own. They don't have the money. They can't pay for, volunteers to participate in the clinical trial. But in this case, the US government guaranteed there's money, and they called this the warp speed, right? They wanted to do the vaccine as quickly as possible because the virus was killing people. And different people, different universities came together, people collaborated, in a way that we've never seen before. And then coupled with the new mRNA technology, whereby you can just get an mRNA and load it onto a lipid. We call this polyethylene glycol, and then this can be taken up by the cell. This is a very, very new technology, and it works perfect. So I think in terms of, was it fast? Yes. Why? Because a lot of money was put in. There's lots of collaboration, and there was one simple message that let's get a vaccine, let's protect ourselves. This is a pandemic. We've seen another pandemic before in 1918. It killed so many people. We don't want that to happen again. So that's why we have the warp speed. And that's
okay. Okay. Actually, I'm glad you said that, because you clarified that to me too, for me, because I am, I was wondering why it has, taken so, it didn't take that much time. I think, I forget what year that was, but Obama did mention that, it's going to take over a year before we can have a vaccine, things like that. And now, with the government that we have, so it only makes sense for some people to be thinking, that guy doesn't like us. You know what I mean? So, right. I mean, Washo, I think I told you that too. Yeah. But now, Dr. Chiogozi, before I can come back to you, Washo, every year, especially healthcare workers, you have to get a vaccine, a flu vaccine. If you don't get a flu vaccine, then you have to wear a mask, right? So, but even though some people still get vaccines, some people don't, those that get vaccine, they still get sick. Some, not all, they still get sick. So with this COVID vaccine, is there any guarantees that if you get a vaccine, not necessarily, I don't want to say guarantees because nothing is guaranteed, but is it safe to say that if you get it, you still may get COVID then? If I, think about it like the flu?
Right. Right now, Monica, no one really knows whether someone can still get it with a vaccine. However, let me go back to the flu vaccine, for example. People have been known to get the flu even after getting the flu vaccine, but it turns out not to be as severe an infection as one who didn't get the vaccine. So right now, no one really knows whether people who have had the vaccine can get the infection. But be it as it may, because of that, some of us, I have decided I'm not about to test my own vaccine. So I'm going to continue to socially isolate, to wear my mask, because I really don't want to test to see if the vaccine is going to work or not. So I encourage people, even if you get the vaccine, you still need to wear your mask. You still need to follow the rules of science. So right now, COVID remains a moving target. The vaccine also remains a moving target.
Yes. Okay, and so Washo, remember when we talked about flu vaccines, and you were saying some people do not get the flu. They don't get the flu. They don't contract the flu because everybody around them have the flu vaccine. Can you explain that for our listeners and the viewers?
Yes, there's something that we call herd immunity, which will be, I can see will be very, very difficult. The doctors can validate this. It will be very, very difficult when it comes to the COVID vaccine. But it's just because of the surrounding propaganda, of it. And that's why, I'm thankful for you for holding this show. I hope many people will be able to watch it. Now, there's something that's called herd immunity. The herd immunity, the target that we have right now for COVID vaccine, it's 70 to 80%. The moment you are able to vaccinate at least adults, 70 to 80%, you will achieve something called herd immunity, okay? And this is what, children, remember the vaccine has not been tested, amongst children between 0 years to 0 years to 16 years. And that's why they're not getting the vaccine. So they will depend on us, me, you, and everybody else to get vaccinated so that they can benefit, from the herd immunity. Okay, let's not expect your 16-year-old or you are 3-month-old or you are 6-month-old to actually go get the vaccine, because it has not been tested on that population. But how are they going to get their immunity? They will get their immunity when you and I and everybody else gets immunized, and we increase that threshold to about 70%. The same thing happens with the flu vaccine. You know, and that's what I wanted to say also. Dr. Aga can correct me, and the doctor. What people have not realized about the flu vaccine, it's developed every year, actually.
Mm-hmm.
The flu vaccine that we get every single year, it's never the same as the one you got the previous year. So this is this question about, oh, they developed the vaccine very quicker, and that's why, like in 2018, everybody got so sick, because for some reason there's something they missed. We never even managed to get to that herd immunity. And many people really got the flu. But then when you're vaccinated, like Dr. Chagozi said, I want to say this very, very clearly from a public health perspective. When you get vaccinated, it doesn't mean that you will not get the infection. You will get the infection, but you will avoid the illness. You will avoid the severe illness. A severity that is not even known to us yet. We really do not know the new variants, like I had said earlier. We do not know what they are going to become. We do not know what complications that are going to come with them. So yeah, the best thing is to get vaccinated. Also, just to connect this so that people can understand better. When you have the herd immunity between 70 to 80% or over 70%, that's what protects the children. I can give you a very good example that I think, Monica, I mentioned to you sometime back about the measles outbreak here, especially here in California. And also we also had, the outbreak in the Amish community. The anti-vaxxers can actually convince people to not vaccinate their kid, and that's their children. And that's something that we have seen even here in California a lot, in Los Angeles, like the 2019 outbreak of measles. Now, how did that happen? It happened because we fell down with the herd immunity. The herd immunity is what protects our children. The herd immunity is actually what was keeping our children from not having the measles. But the moment that herd immunity dropped, we started having our kids, about 90 kids, many of them died, having the measles. So what happened is we were having people coming into doctor's office at 9 years old, and they're asking for the measles vaccine. So herd immunity is very, very, very important. And that's what even the government is trying to achieve, to have everybody immunized so that we can actually bring a halt to COVID-19. Thank you, Monica.
Okay, and Washo, I'm gonna ask you this question as well before I can go to the next thing. I think, or I know, rather, I've had these fears that in Los Angeles, you may be running out of ICU beds because of COVID-19 patients. You're a nurse. What is the triage process to minimize exposure to frontline workers and even to patients that are coming maybe for, they've been admitted for different diagnoses, not necessarily COVID, but just so that you can avoid nosocomial infections?
We already have ran out of ICU beds, just so I can put that out there. We have, like in my hospital, we have started creating ICU beds in areas that there shouldn't be any. Like you find every floor, you have to figure out, let's make one. I mean, it's bad. It's I don't even know how to explain, but I don't want to scare anybody. Now, about the triage, this is the most important thing that I want to communicate out there. When do you show up in the hospital? Okay, at what point do you show up in the hospital? Most of us that have been diagnosed with COVID is everywhere, especially here in Los Angeles. I mean, it is everywhere. But at what point do you go to the hospital? Okay, first of all, the first thing is stay at home. Stay home. until you get short of breath. If you feel like you cannot breathe, you cannot catch your breath, then that will be the time to come to the hospital. As far as triaging, also, we do a lot of triage. We do the physical triage that we do in the ER, and then there's also the other physical triage that our EMTs and our firefighters do in the community. So those are two different ways. A lot has changed. Something like resuscitation, it has to last about 20 minutes, and then they have to reevaluate you because we do not have any ICU beds. So if they resuscitate you for 20 minutes and they don't revive you, they have to call it, because even when you come to the hospital, the mortality rate will still be high. They don't have anywhere to keep you. They don't have staff to take care of you. So triaging, there are very many aspects of it, but I must say a lot has changed. So for people who are listening to us that are out there, if it's something that you can take care of, stay home. If it's something that, a little cough here and there, just stay home. Let's just save those beds for those people who really need to have those beds. And as far as the healthcare workers, the first thing, as far as protection and frontline protection, the first thing that we are doing is to encourage vaccination. We have spoken about vaccinations at length. My hospital, we are vaccinating every single day. I mean, they are there and from 7 o'clock to like 10 o'clock and just vaccinating people. So that's the best way that you can protect the frontline workers at this point. And of course, like we explained, with Dr. Chagozi about, the infection, we are continuing to wear our mask. We are continuing to wear our N95s. But the one thing that you cannot avoid the infection itself. So we still have to take care of the sick. We still have to intubate those who need to be intubated. We still have to take care of the COVID patients. But we cannot negate the fact that they have taken over the beds that lung transplants would have required. Another person that's ill would have required. Septic patients would have required. So that's one thing that we need to put out there, that, this COVID has really overtaken activities in many hospitals. Thank you, Monica.
Wow. Dr. Chagozi.
Yes, Monica.
Did you want to say something, Dr. Agag? Did you want to add?
Yes, I wanted to add to what was
okay.
Said. Again, we are having 1 in 3, residents of Los Angeles, they have COVID. And, a resident of Los Angeles dies every 10 minutes from COVID. So, I'd just like to encourage our viewers to, maintain social distancing, stay at home and just listen to the public health officials. It's as simple as that. COVID is out there in Los Angeles. It's pretty bad now. We don't have ICU beds, and the only way we can mitigate this is by following the instructions from the public health officials. Okay.
Yeah, definitely. So, Dr. Chagozi, I wanted to ask you, the vaccine is a weakened form of the virus. If someone had contracted COVID-19 and recovered, do they still require the vaccine? Can they still get vaccinated?
Absolutely. Thank you for that question. Yes, they ought to be vaccinated because, first of all, they probably need to wait at least 21 days to 28 days before getting vaccinated. It has been shown that even if you have the infection, that the antibodies that you develop may not be enough to protect you from getting the infection again. In addition, people have been shown to have actually developed a second infection. In fact, I have a colleague of mine who actually had COVID in March, and then in June, he developed COVID again, and this time he had to be put in ICU, but thankfully the person survived. So yes, after COVID infection, people ought to get their vaccine after a short wait period. It is important that also continue to socially distance and wear their mask and avoid large crowds. So it is important again that people take this seriously. This is a deadly disease, and I cannot mention enough of the fact that if you get infection and survive, there are still lasting effects that may go on for months to possibly years. So again, prevention remains better than cure. Unfortunately, here there's no cure.
Can I add something?
Yeah. I was actually coming back to you before you say something. Maybe you're gonna add this to what you're about to say too. But when you add to what you're about to say, can you also tell us? I know Washo, y'all have been talking about the different variants. Can you also tell us, Dr. Agag, if this vaccine is going to be able to combat those variants as well, while you add on to what you want to add on?
Yeah, so again, just adding on to what Dr. Chiagozi said, at this moment in time, we do not know how long someone is protected from, getting sick again after recovering from COVID-19. And the immunity that you gain from having an infection, we refer to this as, natural immunity, and it varies from person to person. So we have some early evidence that suggests that this natural immunity may not last very long. We don't know how long you're gonna be, we don't know how long this immunity is gonna be produced by the vaccination. So, once people get the vaccine, then we're gonna follow them through and see how long this immunity lasts. And until we have more data on how well the vaccine works, we can't comment on this. But hopefully, we hope for long-term immunity. All right. So, so the question is, can this vaccine protect against the new variants that are circulating in the population, right?
Yeah.
I think the answer might be yes, but we need to kind of follow through. And so how do we do this? At the moment, we know there are 3 variants. As far as I know, Chegozi, correct me if I'm wrong. So I know we have the American variant. I think we have an American variant. There's the UK variant, the South African variant. But the quicker or the faster we vaccinate our populations, then we're going to put so much pressure on the virus, and it won't have a chance to kind of undergo all these mutations. So the faster the population gets vaccinated, I will be able to kind of eliminate the virus, and we won't have to deal with all these antigenic variations that the virus is able to undertake in order to avoid the immune pressure. Jagosi, you want to add something?
No, I mean you're right on the ball. Again, this remains a moving target, and getting the vaccine early will help ward off more mutations. Is what we're hoping. But at least it's well known now that the current vaccines that we have appear to be protective, especially the mRNA vaccines of Pfizer and Moderna appear to be protective against the mutated viruses. So again, we encourage everyone to take the vaccine. It's better to get the vaccine and have small side effect than to have the disease and possibly die or have lasting effects from the disease.
Okay, and then just, one more thing for our viewers, just know that the spike protein, it's a core protein of the virus. What makes the virus a virus. So the virus will likely need to accumulate multiple mutations, so tons and tons of mutations in the spike protein in order to evade immunity that's induced by the vaccines, the Moderna and the Pfizer vaccines that we have there. So based on that, I think both vaccines are going to be effective against the variants that are currently circulating in the population. And the reason being, you are who you are, right? The virus cannot change some of its components, because if it changes some of the key components that makes it to be a virus, then it's no longer coronavirus. So that's my take.
I just, if Monica, you can let me.
Yeah, go ahead, Washo. Yeah.
Yes, I wanted to add on what the 2 doctors have said, but I'm a nurse. This is an advocacy sort of of a statement I want to make. Currently, we do have, I don't know if conflict is the word to use, and yeah, so, but it's an advocacy statement that I want to put out there. Now, the way this vaccine has been made, it has to have a booster. Okay, if you get the vaccine, the first vaccine, and do not get the booster, you are not protected. That's one thing I want to put across. And why I want to say that, it's because there's a rollout that the government is about to do. And what they have discovered is, or what from following, again, this is public health perspective. You know, I love public health, and this is something that I follow, you know, keenly. Now, they want to roll out mass vaccination, and I'm okay with that, 100% okay with that. But there's a question on whether the first dose will be followed by the second dose. They are not sure about the second dose. So I really want to put a word of advocacy out there that when you get the first vaccine, Moderna is 21 days, Pfizer is 28 days, and then Pfizer is 21.
That's correct, yes.
That is correct. Please make sure that you are in a situation where you can get both the vaccine and also the booster. And I'm saying this because I have had through different channels, I've looked at the CDC, there will be a big rollout, there will be mass vaccination that's coming up, but as long as you do not get the 2 vaccines, okay, I don't know how the immunity is gonna work. So
okay.
I'm just saying.
So Washo, yeah. let me stop you right there. And I want you to, I want to make sure everybody understands, you know, yes. Because we've heard that you're getting 2 doses, right? The first and the second. So right. Is your first one the vaccine and then the second one the booster? Is that what you're saying? Or you're getting the first, the second one, and then you have to get a booster? Can you clarify that?
No, you're getting 2 doses. They call the second one the booster just because it's boosting the first one. It's just a term, Dr. Agak.
Wait, I mean, you have to dumb it down for us. You guys are being too technical.
Can I jump in?
Yeah, so technically you should get 2 vaccines. 2 vaccines.
Can I have?
Yeah. Yes. So once you get the first vaccine, after 21 days or 28 days, depending on whether you're getting Pfizer or you're getting Moderna, I don't know which other one will be approved.
Make
sure that you get the second one of it, which is
that's the booster.
Yes. So you are only getting.
Thank you.
Vaccines. Yeah.
Okay. So this classroom is good because now we are on the same page. Dr. Agak, what were you gonna say?
I just wanted to add to what was just said, and just make sure that if you don't get mixed up. If you got the Pfizer vaccine, the booster has to be the second Pfizer. Okay.
Right.
Okay.
Moderna, and go get a booster of Pfizer. Okay. Your PCP, your primary care physician, they have your records, and they're just gonna check. Okay, you got the first Pfizer, and then they're gonna give you a second Pfizer. Okay. Okay, that's all I want.
Okay. Okay, and when are they? Yeah, go ahead. You can jump in, Dr. Chiagozi.
Sure. I think that wherever the vaccines are being given, people are being given a vaccine card that shows you where you got the first one and the date for the second one. And I also believe that rolling out, the vaccine to give everyone the vaccine right now, it's a good thing, because I know Pfizer or Moderna, they're not going to just sit waiting to run out of vaccines. They also want to make money. So I believe that once this is done, they're already working on pushing out more vaccines. So I strongly believe that, people are going to get a second one once the first ones are rolled out. That's my belief. So,
okay. Yes. So again, Washo, I think they're rolling out this vaccine. They're administering these vaccines to I guess people over a certain age and frontline workers, right? For now, until they can have enough vaccine to vaccinate everybody else, correct?
Yeah, and that's what I was speaking about. And this is when everything gets politicized. So again, there's the rollout of the vaccine for mass vaccination, correct? But what the understanding was out there is that the first doses guaranteed, check, okay? The problem was the second dose. So I'm trying to educate people out there. When you get the first one, make sure you get the second dose.
Right.
So don't get the first one and then disappear and like, oh, I am good
It's
to
over.
go. No, please get the 2 doses. Even if there's a rollout problem, you can always ask from your doctor's office, do you have the second vaccine? Do you have, when will I be coming back? So that make sure you are scheduled for the next vaccine. When we got in UCLA, when we got the first vaccine, we scheduled for the second one that very day. So that's the advocacy I'm trying to put out there. Don't get the first dose of the vaccine and say, hey, I am already protected. No. So that's the education I'm trying to put out there.
Absolutely.
Okay. All right.
Yeah, Monica, let me just jump in again. Thankfully, everyone has a smartphone now or has an email. Where I took my vaccine, once you take the first one, they schedule you for the second one, and then they send you a text the day before or send you an email that you ought to come for the second vaccine. And if you don't come on time, in fact, they have someone calling you to come because they don't want to waste the vaccine. So that they're making it strictly, And again, for us in Texas, in some areas, now they're even vaccinating household members or frontline workers. So I am lucky in that area that my family has now been vaccinated as well because I'm a frontline worker. That's correct. So, yes.
Okay. So, Dr. Chiagozi, can you very quickly tell us, is this vaccine contraindicated for people that are immunocompromised? Do we know that yet?
We don't know that yet. Don't know that yet. But one important area is people with multiple sclerosis. It was initially thought that they shouldn't get this vaccine, but no, they can get the vaccine. Those who have multiple sclerosis. Right now, it is contraindicated in those who have allergies to components, those who have hypersensitivity reactions, but not really for the immunocompromised, really, for now.
Okay.
Yeah, but those who have really severe allergic reactions to lots of things are the ones that are contraindicated for now. But otherwise, there are no major contraindications right now.
Okay.
Yes.
Okay. All right.
But George can, unless George want to add something to that. So.
Yeah, Dr. Agak, you want to add something to that?
I think it's safe. During the vaccine trial, they had they reported some, very few people. I think it was the Moderna vaccine.
Yeah, it was
hypersensitivity reactions, but it's very rare. So again, if you go to the vaccination site, you're gonna get the vaccine, and then they're gonna tell you to sit down for 15 minutes to see if you have, any problems, and they're gonna take care of it. So again, very rare.
Safe.
So it's safe. So I encourage people to go get the shot.
Okay. All right. I want to say this. My son went out I think he was just going shopping with his friends, but then one of his friends had contracted COVID. That's like it's more than a month ago. He doesn't, he's asymptomatic now. But so my son thought they were only going to shop, but they ended up eating. So because he had to take off his mask and eat, so while he's around the house and my dad is here to visit, my son told me, I have to self-isolate. I'm like, why? He said, because I ate with so-and-so and he had COVID. I was like, you don't have anything. I don't believe, you can contract COVID from him yet. I mean, at right now. But then he said, we have an old man living with us right now. As my dad. So my dad just got vaccinated yesterday, so my son is feeling safer. So anyway, but I want to come to you, Washo, and then we'll go to you, Dr. Chiagozi, and then you, Dr. Agak. And I want you guys to speak to the naysayers out there, as people that still are not convinced. Just give them your final remarks. Something else that you forgot to have said. Say that, and then we can close because I think we've already gone over an hour.
Absolutely. Thank you so much again for having me. I will go back again and talk about your son. Now, when you come into the hospital and you are having any kind of symptoms that are suggestive of COVID, we will ask you, number one question, have you come into contact with somebody who has COVID? So your son is very, very correct. He has come into contact with somebody who has COVID, and yes, he needs to isolate. That's without a question. He was in contact.
Yes, be happy you said that.
Actually, they took out the mask. So that means that there is a chance that he probably, you know, got the droplets. And yeah, and I think I do agree with him, because that's one of the ways that we are contracting the disease, you know. So with that said, I'm gonna go back to the statements that I had earlier, you know, as far as vaccination. This is America. This is America. We have seen groupings. We have seen people going on their normal businesses. People are in the grocery stores. People are having gatherings. The same thing that's happening also in Kenya and other countries, but the vaccine hasn't gotten there. Now, as long as you are not restricting people's movements, as long as you are not restricting the targets, the only other option that you have is to vaccinate. Because if you don't vaccinate, you will have a lot more variants, like we have discussed. We do not know what not side effects or long-term effects, or even the immediate effects that we'll get from the new variants that we are discovering. However, we do have this vaccine that has been tested on majority of the variants. I know the Pfizer has been tested. I don't know about Moderna, and they are effective against it. And I'm saying vaccination, 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 because I know where we have gotten, especially here in the United States, there's not going to be any form of a lockdown. There will not be. I know New Zealand will go with even not having the vaccine, but how did they succeed? They stabilized their targets. Okay, there was a complete lockdown. Nobody moved. They only opened essential services, and within no time, in a period of about 6 months, they were able to completely get rid of COVID. If one person gets the COVID infection in New Zealand, they are going on a complete lockdown, and that's how they have managed to, you know, to sort out this problem. And they have done it without a vaccine. And they will continue to do it without a vaccine as long as they continue to hold the targets, you know? Yeah, so for me, and in America, the way we are seeing it right now with the deaths and all these variants, vaccination is the only way that we'll be able to curb this disease. So go get vaccinated. Thank you, Monica.
Yeah. So while I'm coming to you, Dr. Chiagozie and Dr. Agak, I know I'm going to this woman, she's going to get me if I don't say this, but she sent me this question this morning. I was just about to forget, but this is what she said. In Africa, literally nobody is wearing masks. We see people congregate in masses for weddings, deaths, etc. What is the take of your panel on what is going on in Africa? Can any one of you guys answer?
Sure, I'll take it. Go ahead, Dr. Agak.
So,
okay.
You know, this is what we need to kind of remind our viewers, you know, protect yourself and others. The best way to prevent illness is to avoid being exposed to the virus. And, you know, you can take steps to slow the spread. And we know the steps. Stay at least 6 feet away from others. Cover your mouth and nose with a mask, right? Wash your hands. Avoid crowded indoor spaces. And, you know, stay at home and isolate from others when you're sick, you know. And again, routinely clean, disinfect, and take this, you know, necessary steps to avoid the spread of the virus at home. So this is not rocket science. Just, you know, follow the public health officials, and we should be able to stop the spread of the disease. And in Africa, once the vaccine becomes available, please go and take the vaccine.
I think what, and this is Coach K, I think what she's asking, or, you know, I'm not trying to read her mind, but as much as they are congregating, they're not getting as infected as in America or other countries.
Let me take that.
Or is it because they're not testing?
No, they're
Dr.
getting
Chiagozie?
infected. They're getting infected. I can give you an example. Before I started this panel, I got a message from Nigeria. There was someone who went from here to take a chieftaincy title in Nigeria. And of course, he was dancing all over and being sprayed money on. 2 days after that, he became ill, in fact, and they thought it was malaria. They said it was malaria and typhoid, plus, like they always say. He continues to remain sick in spite of anti-malaria treatment, and he was not tested for COVID. And he did have COVID, and unfortunately, he just passed away 2 days ago. So there is COVID in Nigeria. There is COVID in Africa. It may not be as rampant as it is here because there's lack of testing. It is not being tested. There are not many places you can have it tested. So there is COVID. And also, it's somewhat much hotter there as well. And people are doing something outside. Maybe that's why it's not as, manifest as it is here. But clearly there is COVID and people are dying from COVID. So people should take this seriously, continue to wear masks, no matter where you are in Africa or in the US, as well as, socially distance. It is important, right? And for my, final take on this, COVID remains a moving target. There is no treatment right now. There is no cure. Every treatment we have is mainly supportive. In fact, the only treatment that we have seen that is helping is the steroid, dexamethasone. But you have to catch someone at a sweet point, which is, by this I mean, when someone has started having oxygen requirement, not when they're already mechanically ventilated, not when they're already on life support. So again, this remains a moving target. People need to follow the rules. And last but not the least, take the vaccine. The vaccine is safe. It's better to prevent than to cure. Unfortunately, there's no cure in this case. Thank you for inviting me.
Dr. Agak, will you also, as you give your final remarks on this and your advice, will you also answer Lucy, who is asking if this vaccine is safe for pregnant women? And also, too, will you also address that this vaccine is not to make people in Africa continue having babies?
Okay. So for the expectant mothers, when they did the clinical trials, pregnant mothers were not included. So again, with the vaccinations, we're gonna get the data. And what we recommend is, if you're pregnant, you have to contact your primary care physicians, and then they're gonna advise you on, whether to get the vaccine or not. And in terms of, just listen, what I'll say is people should listen to the public health authorities, and we should, stop spreading all these rumors about, about the vaccine. And, what I always tell people is that, just remember that vaccines, they still remain the safest and the most effective means of preventing infectious disease. So if you have a chance, please go get the vaccine, okay? And, if you have, you wanna learn more about coronavirus, I recommend, people can go to the CDC website, and they have, very relevant information, and you can read for yourself and get to know the truth, okay? So again, get vaccinated, all right? And stay safe, protect yourself and others. That's my, that's all for me. Thanks for
inviting. So for the pregnancy, for the pregnancy part, George Agak, yes. I don't think usually when we are doing our research in public health and many researchers, that will be one of the group that will be exempt from participating in most form of researches. So it hasn't been tested on pregnant people. However, there are people who have gotten vaccine, but they did not know they were pregnant. And some of them actually delivered during the trial. Yes.
So the CDC will compile this information. They're going to follow this. people, and then, we're going to have a message, as to whether this vaccine is, effective.
Yeah, so it hasn't directly been tested on pregnant people, where you have, your sample is actually 10,000, different pregnant women at different stages of pregnancy. Because as always, like I've said, that's always an exception. If you're pregnant, you're not gonna be put in any kind of a research. So no, it hasn't been tested on pregnant.
So that's what I said. So the pregnant expecting women, they were not included in.
Right. Yeah, I was just
Got it. Got it. Okay, so that's gonna do it for us, you guys. But I tell you, today, like, this show has been the best show. It's our first show this year, but it's just been awesome. I feel like I've gone to nursing school. I don't know, like all the schools, even medical school, all of it, right? Because I'm honestly feeling more empowered, and if I'm feeling that way, I'm sure somebody else out there is feeling more empowered and more knowledgeable, about the vaccine and about COVID now, right? But I do want to remind our listeners and our viewers again that information from this show is for educational purposes and does not substitute your healthcare provider's advice. Again, I want to thank you, Dr. Chiagozi, Dr. Agak, Washo, and all the frontline workers for all that you guys do. And again, for you guys being available today. I know you guys are so busy, but you gave us your time today. So as you guys mentioned that this is a moving target, which means we're going to learn more. Can we say that once we learn some more about COVID, that you guys can come back here and we educate the community even more?
It'll be my pleasure.
Okay. I like that. Thank you so much. You guys have a wonderful weekend and be blessed.
Thank you, Monica.
All right.
Thank you, Dr.
Washa.
Thank you, Dr. Gozi.
All right. Bye-bye.
Thanks. Bye.